You have tried many times to lose weight, but you have failed. And now you are so desperate that you have decided to have a weight loss surgery. Don't be in a hurry. Before you decide to take such a serious step, watch this video to the end. Perhaps such an operation is contraindicated for you. Today I will tell you about the purposes and main types of bariatric surgeries, in which cases they can be performed and in which cases they cannot. What are bariatric surgeries for? Bariatric surgeries or metabolic surgery are surgical interventions performed on the digestive organs to, first, reduction of the patient's body weight. Second, normalization of glycemia. Third, normalization of lipid metabolism, arterial hypertension, obstructive sleep apnea syndrome, and other complications of obesity. Fourth, prevention of complications of type 2 diabetes mellitus and cardiovascular diseases. Fifth, improvement of the quality of life of obese patients. There are several types of bariatric surgeries to fulfill the above purposes, and here are the main three types of surgeries. First, endoscopic intraluminal surgeries, when a silicone balloon filled with fluid, saline solution, is inserted into the stomach. Second, restrictive, when most of the stomach is surgically removed longitudinally. Third, bypass surgery, when the surgeon reduces the volume of the stomach and sews the small intestine to the mini stomach. Before performing such a major surgical procedure, the surgeon determines the indications for surgery. The main indications for bariatric surgery are: first, several attempts at conservative treatment of obesity with failure to achieve the patient's weight and overall health goals. And second, lack of long-term retention of results. There are many more contraindications to bariatric surgery: gastric and duodenal ulcer exacerbation, pregnancy, oncologic diseases, the duration of remissions of which after treatment is less than 5 years. Mental disorders such as severe depression, psychosis, drug abuse, etc. Life-threatening diseases in the near future, severe irreversible changes in vital organs such as chronic heart failure, third and fourth functional class, hepatic and renal failure, etc. C-peptide less than 1 nanogram per milliliter or absence of its increase in response to carbohydrate load. C-peptide is a component of the endocrine secretion of the pancreas, which is an indicator of insulin production and is used to diagnose diabetes mellitus and the condition of the pancreas. Preoperative determination of basal C-peptide is necessary to predict the likelihood of remission of type 2 diabetes mellitus. These contraindications are absolute, that is, if they are present, surgery should not be performed. There are two more important contraindications to bariatric surgery. First, absence of attempts at conservative treatment. If you have not even tried to lose excess weight, please do not go straight to surgery. There are possible complications in any surgery. And second, lack of proper patient discipline and opportunity to participate in long-term post-operative follow-up. You can have your stomach turned into a tube and have a mini stomach like a kitten. But if you keep eating buckets of food, you will stretch your stomach and gain weight over time. You can have a balloon installed in your stomach, but if you eat fast food or burgers every single day and drink sugary sodas, you will gain excess weight with that amount of empty calories. There is no point in stitching up your stomach if you haven't learned to close your mouth. Please hear me right, for the sake of your health. If this video was helpful to you, be sure to share it with your friends. Check out my previous video about best food for constipation. I wish you health, love and light. Your Dr. Zarifa Romanova.